In addition to just the growth in membership, which has really been phenomenal over the past few years, we're seeing rates of premium growth that are lower over the last 4 years than general inflation. So that's just an indicator of how the marketplaces are stabilizing and healthier today than they have been at some periods in the past. We're coming up on a major battle here, which will be whether the enhanced tax credits that were available to consumers since early on in the pandemic will be extended. And it's certainly our hope that that is something that Congress does so that these marketplaces remain strong and stable. The metal levels are, so there are metal levels like bronze, silver, gold on the exchanges. They were really designed to help people understand how much cost sharing protection they would get in any given plan. So they have what are called actuarial values attached to them. We don't need to go into that, but essentially if you're choosing a bronze plan, you'll get less protection generally than if you're choosing a silver plan. And for people who enroll in silver plans, they get additional protection called cost sharing reductions. So for people who are lower income, need that protection, it's important to consider the silver plans in that scenario. If those enhanced tax credits expire, everybody on the marketplace who's eligible for tax credit will see a premium increase. And the level of premium increase could be as high or is likely to be on average more than $1,000 in 2026. So if Congress doesn't act by the end of 2025, and really I think that should be, Congress should act much earlier than that, and we can talk about why that's so, people will be exposed to those higher premium costs, and they'll actually be exposed to those beginning during open enrollment, in the fall of 2025. So there's a need for Congress to act pretty quickly next year to extend those enhanced premium tax credits. If Congress doesn't act to do that, I think you'll see some pretty significant impacts on the marketplace. Based on some of the public estimates that have already been released, more than 5 million people could lose their health insurance coverage. The enhanced tax credits actually lowered the amount people pay for their premium across the board. And so if you look at the growth we've seen on the marketplaces since 2022, the marketplaces have grown by 88% during that period. The place where they've actually grown the most are in states that haven't expanded Medicaid. So think about, Texas, 212% growth. Alabama, 190% growth. So a lot of these more conservative states that haven't expanded Medicaid have seen significant growth, in part because those tax credits were enhanced for that lower income population that otherwise wouldn't be able to afford coverage.
When folks are between jobs, when folks are starting off on their own, when in all of those sorts of situations, the marketplaces are there as a backstop, and I think they are in ways more and more common. They are becoming a key economic tool for the vibrancy of our economy, because folks know that they can move jobs, they can leave their jobs, they can start their own businesses, and find coverage. There's a number of ways. You can go to the website, which lots of people do. You can call the call center, and a person on the other end will help walk you through the process. The purchase of health insurance is often complicated, and sometimes it helps to have someone help you through it. And then there's this huge channel of navigators who are sort of community funded and funded by the federal government or the exchange entities that will help you do this, or agents and brokers, which is by far the biggest channel for this. Agents and brokers across the country will help people find the coverage that that is best for them. You go through this process where you answer a bunch of questions, often with the help of someone, and then you can figure out exactly how much you can get in advance. And then at the end of the tax year, so you finish that year, when it comes time to file your taxes, there's a reconciliation that happens. You write down essentially how much financial assistance you got each month, and then they look at your taxable income, and they compare it to to that table, and they say, oh, actually it turns out that you claimed a little bit too much, or you didn't claim enough, and then you get a refund or or have to pay in more in taxes. But there's a reconciliation at the end, because a lot of the stuff at the beginning of the year, if these enhanced tax credits do expire, as Chris points out, what happens is this coverage becomes a lot less affordable for a lot of people, and we can expect that a very significant number of them might choose not to continue their coverage. That itself, will end up raising premiums for those who stay, which can feed this negative loop where, as the premiums go up, more people say, "Oh, I don't know if I, am willing to pay for that." And then what happens is hospital systems often get stuck with a lot of care that they can't get reimbursed for. So this ends up being, yet another financial stressor on hospital systems as well. So I do notice, and I have noticed that, in fact, trade groups like the American Hospital Association and the AMA, so the physicians out there, I mean, a lot of the groups in the healthcare system are really interested in pushing hard for the extension of these enhanced tax credits. The Affordable Care Act provides for community organizations called navigators to help get folks into coverage, to help folks figure out what they're eligible for, whether that be Medicaid, whether that be marketplace coverage, that sort of thing. CMS has really invested very aggressively in outreach to folks all over the country, as well as funding navigators all over the country to identify folks who aren't covered and to help them get it into coverage. Many of those navigators are affiliated with hospital systems. One of the big factors for eligibility for marketplace coverage is that as a legal matter, you have to be lawfully present in the country. And so, and that's in the statute. And so there are subpopulations of folks in this country who are not eligible for exchange coverage because of that. Some of this gets very tricky, for example, in say in Hispanic communities, where you have families that that have mixed status in terms of documentation and the like. So some of the folks in the family might be eligible for marketplace coverage or for other Medicaid or other forms of coverage, but some in the family might not be, and we think often in these families there's a significant reluctance to engage with these kinds of federal programs.